to the our virtual group consultation here at Egoscue of San Diego. For those that don't know who I am, my name is Tim George. I'm the clinic director here. We are joined by another one of the amazing and talented therapists here as well. Carrie is on the call as well. Hi, Carrie. Appreciate you all being here tonight. You're gonna be a little interactive with this workshop tonight. If I know some of you have been to these before, but others have not, and I know some of you are familiar with Egoscue. Others on the call may not be as familiar. This is a great workshop for really anyone. Kind of gives you, if you are familiar with what we do at Egoscue, it kind of reinforces what it is we do. Maybe gives you that shot in the arm to jump back into your one of your menus and get your body back in balance. For those that are not familiar with Egoscue, it's a really good, a deep dive into who we are, what it is we actually do, how we do it, who we help. We like to really be interactive with these consults. Usually they're here in the clinic, but given the unprecedented times we're living through right now, Zoom has been a great avenue for us to hold these, because it's the way that we've been doing therapy for quite some time now, is through the online, using Zoom to still reach some of our clients. So I will have you guys up doing some exercises, and if there is someone on the call that would be willing to volunteer to kind of be like a test subject for us all, to kind of see, get everyone a good idea how we do things via Zoom or Skype or FaceTime, any type of a webcam. So I will be calling on someone if they are willing to volunteer to kind of go through the process a little bit, so not only you, but the rest of the participants kind of see how it is we do what we do here at Egoscue virtually. Of course, if you have questions along the way, let me know, but we'll kind of dive in first in terms of what it is we do. The short answer to that question when someone is asked, what is Egoscue, or what is it we do at Egoscue? Real simply put, is that we help people live an active, pain-free lifestyle through better posture. It's that simple. The way we look at the human body is that it's designed to be symmetrical. What you see on the screen right now is what we consider to be the blueprint of the human body. And when our body is balanced, front to back, left to right, our load joints, our major load-bearing joints, the shoulders, the hips, knees, and ankles are lined up across one another, stacked up vertically on top of one another, is when our body is going to be operating and functioning at its best. And this is what we're all about. It's just trying to bring the body back into balance through movement, through exercise. All right, we're going to go a little bit deeper into that as well. All right. So what brings people more often than not to the Egoscue method is pain. I've been with this company and doing the Egoscue therapy, helping people with the Egoscue therapy for almost over 15 years now. And I can count on one hand how many times someone has come in to seek out our services that has not been in pain. So most people do come to us because they are in pain, and it could be back pain, shoulder pain, hip pain, knee pain, foot pain, headaches, wrist pain, you name it. And the diagnosis that they come in with can vary as well, from a bulging disc to sciatic nerve impingement, plantar fasciitis, bursitis, tendonitis, any other itis you can think of there. So pain, that what brings people into our clinics, there's a lot of things that bring them into the clinic in terms of their pain and what they're diagnosed with. What we always want to try to present to the people that seek out our services is, what is that pain really trying to tell us? All right, we consider ourselves at Egoscue, we're the why people. All right, we want to figure out why your back is hurting. We want to figure out why your shoulder's hurting. Because a lot of times, short of a major trauma, if you get hit by a car, well, we know what might have caused your hip pain. Or that's a serious trauma. But for a lot of us, and maybe some of you on this call, when pain does start to arise, there isn't a major trauma. We hear it every day in our clinics, and obviously now online. That, hey, how'd you hurt your knee? Like, I don't know, it's just walking around like I normally do, and all of a sudden my knee started killing me, or going to pick up something off the floor and my back went out, or reach for something off the shelf, all of a sudden I got this twinge in my shoulder, and sometimes the pain just seems to come out of nowhere, and and it may seem that way, but again, that's what we really want to try to dive into. Okay, what is that pain trying to tell me? Why is that pain there? All right, here's what we don't think. We don't think that pain is there because we're getting old. We don't think that pain is there because of bad genetics. I got a family history of knee pain, so I'm destined to have knee pain. I had a client. He came in. I was like, so what's causing your lower back pain? I asked him, and he goes, I just, I got the Bowers back. His last name being Bowers. I'm like, what do you mean? Is that some new back condition? He's like, no, it's just a family history of back pain. Those things are not true. Old age does not mean we're going to have pain. All right, your family history doesn't mean you're going to have joint pain or back pain, whatever it might be. Your activities are not going to cause your pain. Pain, from our perspective, the way we view pain at Egoscue, is a signal. Your body's trying to tell you something. And the question we present to our clients is that back pain that you are having? Is that shoulder pain, knee pain, whatever your diagnosis is that pain a symptom of your body being a little off balance? Your posture not being where it should be, where it's designed to be. Is that possible? All right. And what we'll do with clients is we'll look at their posture. Client will come in like this gentleman here, and we'll take photos of their posture. We'll take 4 photos, front, back, right, left sides, so we can really compare where their posture is compared to the diagram, the blueprint that was in the earlier slide. All right. So we can look at this gentleman right here, and it doesn't take a postural alignment specialist to really see that there are some major imbalances going on in this person's posture. Look at that front view there, that red line. If we put that line right between the ankles, it should go right all the way up through the center of his body. You can clearly see how much his upper body starts to offset to one side, really offsets to the right. All right. So this person comes in and he's having lower back pain. What we're going to represent, and I mean, if you walked around like this most of your day, you might have some lower back pain as well. All right. And now that lower back pain might be diagnosed with as like a bulging disc or a herniated disc or maybe some degenerative disc disease, but that diagnosis doesn't really tell us the why. All right. Why is that back breaking down on me? Or why is one hip hurting and not the other hip? Why is one knee hurting and not the other knee? All right. It's because the body has gotten a little off balance. All right. You can see it here in this front view, and we go to the side views. You can clearly see in the side views, the imbalance there in those load-bearing joints. If our load-bearing joints, if they're designed to be stacked right on top of one another, head, shoulders, hips, knees, and ankles, we can see that mainly on one side more than the other, that those load joints don't line up very well. I mean, just look at the difference where that red line hits his right shoulder versus left shoulder. All right. So clearly differences there in his postures from front to back and left to right. All right. So that's how you want to view pain. When that pain comes about, that's what we want to really look at in terms, in terms of what's causing that pain is, again, could it be from a body that's gotten a little off balance? All right. Or a lot off balance. All right. All right. Comments, questions so far? Okay, good. Now, when it comes to pain, the next question I have is, okay, how do we eliminate that pain? There's a lot of ways we can eliminate pain, and some of these we probably have been through. We have chiropractors, massage therapists, acupuncturists, phenomenal, really great ways to treat your pain and to eliminate the pain. All right, there are definitely modalities that I do myself. Pain pills, that's definitely an option. We all know that's just a Band-Aid. That really doesn't get to the real cause of that pain. Surgery, a lot of times for us, it's that last ditch resort. Or last thing we want to do is have surgery, but sometimes we feel like there's nowhere else we can go to get some relief from that pain. A lot of times maybe we'll go, we might stop that activity. A lot of times where we blame tennis or we blame golf for that shoulder and knee pain we are having. So we're like, oh wait, you know what? I just won't play that sport anymore. So we just start to limit our activities, as a way to eliminate pain. All right. Or we'll just try to brace it, put a back brace on, put a knee brace on, ankle brace, wrist brace. I've been by plenty of tennis courts and watched plenty of tennis players, essentially put a brace almost on every joint of the body just to get out there on the court. And if you look at a lot of these ways to eliminate pain, particularly the pain meds, the drugs, the surgeries, putting a brace on the joint, it's not really solving the problem. It's just essentially treating the symptom. All right. Just taking a break from that activity. Again, we're not really getting to the core cause of why that pain is coming about. All right. Because our bodies are designed to do a lot of things, and sports is one of them. And if something hurts, what we don't want to do, we don't want to blame the activity, but the body we take into the activity. All right. Going back now to chiropractic, massage, acupuncture, great modalities. Like I said, those are ones that I do myself. But there's a key missing ingredient in those modalities, and that ingredient is us as an individual. All right. We go to the chiropractor, we go to the massage therapist, the acupuncturist, and they can definitely help us eliminate pain. But it's what we do when we leave their office, when we leave their clinic. What do we do to help really make sure our body stays in balance? Because that's really what all those modalities are about. Chiropractic, massage, acupuncture. It's no different than Egoscue in terms of the end result of a more balanced body. All right. So you go to a chiropractic, massage, acupuncture, they get the body in balance. Now, what are you doing as an individual to make sure our body stays balanced once we leave their office? All right. That's something that as individuals, we got to have that responsibility. And that's where your posture plays such a big role in your overall health and wellness. All right. And here's a perfect example, going back to that gentleman that we had before. Key part about here is in order for our body to get back in balance, in order for our posture to be rebalanced, it takes the muscles to move the bones. All right. Muscles move the bones. You gotta, that's a key part of what it is we do and about your posture, is that your muscles do move your bones. And when we do move our body into the right position, the right alignment, I know you guys can't see that bottom part, but it then gives the body the opportunity to heal and move us out of the way. All right. So, right here, you look at this gentleman now, just look at the difference in his balance. Look at that red line going right through the center of the body now. You look at the side views, that red line going right through those major load-bearing joints. All right. He gave his body the right stimulus. He gave his body the right exercises to get his body fully rebalanced. All right. Gave his body now the opportunity to heal, even given his diagnosis, because he came in armed with MRIs with bulging disc, L4, L5, accompanied with sciatic nerve pain, degenerative disc disease. I mean, he had a pretty scary MRI report, given, with the pain that he was in, thinking about surgery. But again, what we wanted him to ask that question is, okay, well, do you think surgery is going to treat the symptom, or is it going to really cure you? And that's what surgery is going to do. It's going to more or less treat the symptom. It's not going to get to the true underlying cause of why his back went out in the first place. That's something that he needs to work on himself take that responsibility, keep his body and his posture as balanced as possible. All right. So that's the big difference there with Egoscue. All right, it's when we look at the body, pain might bring people to our clinics. All right, but a lot of times the site of their pain is rarely the cause of the pain, and that's probably one of the big things we always tell our clients is that we can't just focus on the site of your pain. We got to treat the body as a unit. If we just focus on the side of the pain, like if a client came in and they had right knee pain, all we did is focus on the right knee, and we didn't look at the rest of the body, how imbalances throughout the body, imbalances throughout his posture could be a contributing factor to that pain, then we're just going to be chasing those symptoms. That's the biggest difference there with Egoscue in terms of your traditional PT is treating that whole body. Give you exercises to give your body a full rebalance. All right. When that happens, now your body then has the opportunity to heal, because we all know our body can heal. All right. We get a cut and it heals. We break a bone, it heals. All right. So our body does have the opportunity to heal. But again, we have to get to the right environment. And when the body's out of balance, it's going to be continually under stress. All right. So that's one of that's, I think, the biggest difference there with Egoscue compared to your other, exercise therapies, physical therapies. All right. We want to teach you the importance of posture. Teach you, the importance of posture as it relates to your overall health, so that once you learn how to keep your body in balance, in alignment, that's something that you can really control for the rest of your life and really control your health and well-being from then on out. All right. So we've been talking a lot, like mentioned a lot about posture, that full, the blueprint. And when you hear posture, most people, when I say that, everyone kind of sits up a little bit straighter. You can maybe hear your mom's voice saying, stand up straight, pull your shoulders back. But good posture is not just being able to stand up straight, get everything really balanced. When we have good posture, our body's able to do the things it was designed to do. All right, that's really what we want our clients to reach for, or it's not just getting themselves out of pain, but getting back to doing the things their body was designed to do. That's what we look at as far as having good posture. It's not that you're able to stand up straight, but you're able to do things and not hurt. All right. If we have good posture, we should be able to sit here and listen to me jabber on about posture and not hurt. If we have good posture, we should be able to go play with our grandkids at the beach, go for a hike. Someone says like, oh, I want to go hit up potato chip rock up there. We want to be able to do that. And if we have good posture, our body should be able to handle that. All right. That's what's having good posture really means, is living that life without limitations, not having that thought of, I don't know if I should play tennis today. I might really wreck my knee. It's yeah, sure. I feel good. I should be able to play tennis. I was designed to play tennis. That's what having good posture is all about. All right. So now, how does this all work? Most of the time, if you know anything about Egoscue, we see people here in our clinic. That's how it typically works. Obviously, that's not the easiest thing to do these days. Now, we are starting to open up our clinic more and more. We're starting to see clients here in our clinic on a limited basis, but majority of the clients we are seeing, we're working them, through Zoom, like we are right now. All right. And the way we do therapy through Zoom is no different than how we do it here in therapy. And in many ways, it has more advantages than doing it here in the clinic. All right. But essentially how it all works, it really all starts with a plan of action. All right. So when you work with us online through Zoom, Skype, FaceTime, whatever works for you, the first thing we're going to do is really get a solid health history of what's bringing you in, what this pain is keeping you from doing, how it's affecting your life, really kind of see, okay, what are the goals that you have in mind? Not just getting rid of your back pain, but what does that mean once you're out of pain? What's your life going to then look like? What are some goals that you want to reach for? All right. Really get a plan of action, really get a good history on what's bringing you in. All right. Then we'll take some photos of your posture, just like you saw there in that a couple slides ago, that gentleman. We're going to take photos and we can just take a nice screenshot, and we're going to do, if someone's up for it, we'll do it here tonight once we're in a few minutes. I'll kind of show you how it all works. We take postural photos. We share the screen, much like I'm sharing my screen right now. and go through a full evaluation of your posture. Really point out the imbalances that we do see from head to toe and relate it back to whatever symptom you are coming in with. All right, so we do that posture evaluation. We do some functional tests. So we want to see, given your posture, how your body moves. And that really helps us see where your limitations are in your overall movement, because then that really helps us put together the right set of exercises for you as the individual. All right. And that's a key part of what it is we do with our therapy is specific to you as the individual. All right. And what that means, it means that we're not treating your symptom. All right. Because I can have two people with the exact same symptoms. Both of them can have bone on bone in their right hip, but we got to look at them as individuals. All right. We got to look at them from a postural standpoint, an overall function standpoint, their pain levels, and we got to treat them as individuals. It's not a one size fits all. It's not an A, B, and do C type of therapy. It's a plan of action that's based specifically on what that person needs in their body to get their body back in balance from an exercise standpoint. So we give you those exercises, we take you through them. We deliver those exercises to you via email. Also, we have an app you can download. But as you do your exercises at home, what we then recommend is that we meet with you. We meet with you on a minimum, at least a weekly basis, to review your exercises, reevaluate your posture, and adjust your menu over a series of sessions. All right. And then once we're done and you're feeling good, your posture is just looking perfect, then it's your job to really continue to implement those exercises, implement the tools that you've learned over the sessions that you've worked with your therapist to really change your habits, meaning doing your exercises on a regular basis to really get your body and your posture back to where you want it to be, where you can really live life on your terms. All right. And we're here every step of the way. Like I mentioned, the Egoscue app, it's a phenomenal app that, a great way that we can deliver exercises to our clients. There's really detailed instructions on how we do the exercises, videos that you can follow along with. You can track your progress to see, okay, what exercise you've done that day. You can provide feedback directly to your therapist through the app. It's an awesome tool to help you get the most out of this type of program. You're able to we stay connected with our clients. We encourage our clients to stay connected with their therapists. That's something that we always want to make sure our clients, feel like they are heard and we are listening to them. So that's a big thing that we'll do, is really try to stay connected. However, the client likes to stay connected, whether it's by phone, text, email, you name it. All right. All right. So that's, kind of a rundown. I would love to kind of get a volunteer, if anyone's willing to kind of go through a little posture evaluation and, let us kind of take a look at you and kind of see what this is all about. So do I have anyone that would be willing to step up and volunteer? Don't forget to unmute yourself if you're willing to, or use a chat box.
I'm willing to do it.
All right, who is that?
My office to clear out, so I could.
Carol, hi Carol.
Hi.
How are you?
I'm pretty good, but your program comes highly recommended by a few people that I know.
Oh, okay, nice. Yeah, had you heard of it before they recommended it?
No.
Recommended it to you?
No.
Okay. All right. Well, do you mind if we take a look at your posture? It's just you,
Sure.
me, and whoever else is on this call. So.
Sure, I'm okay with it.
All right. First off, am I on a laptop? Am I on an iPad?
It's a laptop.
Awesome. So, how much space do you have behind you there?
I have quite a bit.
Okay.
And there's another couple of desks. I can get back. I don't know. Let's see.
Yeah, that's good. What I'll need, Carol, if you can just pull your screen down a little bit, that way we'll be able to get your whole body there, and slip your shoes off for us.
And I don't have my pajama pants on, so.
That's all right. Can you pull the screen down a little bit more? And how, I know you got jeans on, but how loose are those on the bottom? I mean, can they roll up above your knees at all?
Well, probably.
Awesome. All right, that's perfect. That's perfect. Okay, so let's do this here. Go ahead and take a small step back for me. Good. Now, first thing I want you to do, Carol, just close your eyes and march in place. Wiggle the shoulders out. All right, good. Go ahead and stop. Leave your feet right where they're at. Don't move them. We just want to try to get you in a more natural standing position. All right, we're going to take a screenshot here of the front view. So just stand nice and relaxed. 1, 2, 3. Awesome. All right, next, turn so I can see your left side view. Perfect. 1, 2, 3. Good. And then we'll get the back view, Carol. 1, 2, 3. Good. And then we'll get that right side view. Last one here. 1, 2, 3. Perfect. All right. You can go ahead and roll your pant legs down. I'm going to get these up on the screen for us and everyone to see. So just give me a minute here. So Carol, do you have any aches and pains that are been bugging you?
I have a really hard time with my lower back. I don't know if I did something to it years ago, but it kind of reoccurs. And now I'm at the point where if I do any kind of lifting or anything out of the ordinary, it's really painful. It's hard to sleep because I have pillows tucked all over the place. And then I also have an issue with my right arm because I'm an architect and I have to click my mouse and hold it down and drag it around all day. And it's just kind of, it started here, it worked up here, I carry all this tension here, and now it's gone all the way back down my back to my lower back.
And have you been to a doc for it, or?
No,
You know,
I was doing, for about 2 years, I did massage a couple times a month, and I've done chiropractor a few times here and there, but I haven't gone to a doctor. Or, you know, I like what my friends told me about this because I really don't like to take medication or anything like that. I would really much rather do things more naturally. And my massage person did give me some exercises to do that have helped, but you know, I've never had anything really specifically done, analyzed about my issues.
Okay, all right. So low back pain, right shoulder pain.
And my kind of my hand and a couple of my fingers from the mouse all day long.
Got it, got it. All right. So can you see those photos that I put up on the screen?
Yes.
All right. So, Carol, what, you know, before I tell you what jumps out to me, if we're comparing it to that blueprint, you know, you're an architect. This is perfect. You're a perfect volunteer. You're an architect. You know about buildings and right angles and blueprints. You know, what really jumps out to you as far as not being balanced, you know, in any one of those photos?
I think
if you don't see anything, that's fine.
My shoulders are off.
Okay, so you can see that right shoulder seems to dip down a bit more than the left shoulder.
Yes.
All right. Now, no doubt, Carol, that's without a doubt, that's probably a product of your occupation. I mean, you've even said it, like, listen, this is what I do. This is what I do on a regular basis. Using the mouse with our right hand, it's no doubt. And, you know, when we look at posture, that's one of the things a lot of times, you know, when we show these photos, the clients are like, oh my gosh, like, how the hell did I get this way? Our posture is, and you already know this, Carol, it's a product of the world that we live in, that we've created for. All right. And, you know, that difference in the shoulder position, yeah, it's no doubt related to your job. But, you know, is that something that, you know, you can just go ahead and stop doing?
No.
No, exactly. Right. All right. So it's something we got to do. We got to, we got to work. We got to, pay our bills and all that. So knowing that we got to keep doing that job that could be throwing our shoulders off balance, what we need to do as individuals is understand that, okay, well, I got to use the mouse. I got to do my job, but are there things that I can do to help my shoulders get rebalanced, help my shoulder position reset once I'm done? And absolutely there can. All right. Because your body wasn't born this way. Your shoulders weren't born one lower than the other. It was developed from repetitive motions, repetitive movements. And it's absolutely something that, as an individual, we can definitely rebalance. And that's one of the things, given your shoulder pain and the wrist pain, for us, when we look at it from an Egoscue perspective, is that the condition that your shoulder and your hand is in is really being driven by the position that your shoulder's in, that dipping down of that right shoulder. And you can even see it when you look at the side views, all right, where we look at that right shoulder versus the left shoulder. Even on that side view, you start to see a little bit more of a rounding forward of that right shoulder. We see a little bit more of the upper back on that right side. Again, given that shoulder position. So that's definitely a postural imbalance that we see as far as, okay, we got to address that through exercises. All right.
Mm-hmm.
And anything else that you see? Anything else that jumps out to you?
No, not really. Well, I think it's because of my shoulders, but one hand's lower than the other. I'm hoping my arms are the same length.
and I no doubt that they probably are. And yeah, that's definitely. I mean, a lot of times, that's one of the things as a postural alignment specialist. We'll look at hand position. We'll look at, hey, is one hand lower than the other, or does it? Looking at that front view, does it look like one hand's closer to us than the other hand? And all that is, definitely being driven by the shoulder position there. All right. Oh, we got Nicole Rastelli. So we got another Egoscue therapist out here. So Nicole Rastelli pointed out something I was just about to point out. But looking mainly at the back view, Carol, look at your hip position. All right. Do you see any imbalance there at the hips? Does it look like, the right and left hip are on the same?
Definitely do. Yeah.
So it looks like almost like that left hip, if we're looking from the back, almost like your left hip is sitting up a little bit higher than the right hip. All right. You see what I'm talking about?
Yes.
All right. So that's significant in terms of the lower back pain. All right. Remember what I talked about earlier, the side of the pain rarely is causing the pain. We were talking about your wrist and hand pain. That's being definitely driven by your shoulder position. That lower back pain, in my opinion, is definitely going to be driven by a hip and pelvic girdle that's not level. Our hips and pelvis were designed to be level. And what it looks like here is that left side of your pelvis seems to be a little bit higher, a little more elevated versus that right side. And you think about, okay, if our spine, I got it. Yeah, I got it right here. So we have our spine here. Hopefully you can see this okay. All right. Our spine, all right, it has a stage, a platform on which it stands on or sits on, and that's our pelvic girdle. All right. And for our spine to be able to do all the things that it was designed to do, and that's twist and turn and bend and extend, and it needs a nice, stable, level platform. And when we're not balanced there, that now particularly your lower back, because that's what's closest to your hips, is really going to be under a lot more pressure because of the imbalance there in your hip and pelvic position.
Those are a lot of the same things the chiropractor has told me, but it's like I feel good when I leave there, and the next day I feel like I'm right back where I was before.
Okay. Do you and given what I've been talking about tonight, do you have a good idea why?
Because I don't have exercises or things to keep
well, I look at it, one way to also look at it is that you go to the chiropractor and you feel good once you leave. That's a benefit, because what it tells us is that, okay, there's nothing here that's broken. all
Mhm.
right, there's just my body's a little off balance because when I go to the chiropractor, I go out of there and I feel good. And maybe you feel good till the next day. Maybe you feel good till you get to the parking lot. But eventually, it's the muscles that pull your body back out of alignment. So the chiropractor is awesome, and it's definitely, if it's helping, you want to continue to do it. But it's like I was saying, what are we then doing to keep the body in balance? And that's where the right exercises come into play. All
Yeah,
right.
and what I'm doing is, instead of the right things, I'm coming back to my desk and just messing it up again.
But there's nothing wrong with that. There's not, all we then got to do is we got to add a little bit more, positive stimulus in terms of the right exercises, because our body should be able to, you should be able to go back to your desk and not suffer for doing it.
Mhm.
It's like I said, but we got to make sure that the body we take into your drafting table, to your desk, is balanced. When that body is balanced, you should be able to sit there and do your work and not hurt. All right. So that's really where it's not about creating a more ergonomic workstation, or, switching hands, with the mouse, which, probably is not something you could do, but it's about, okay, let's at least then do something to get my body in balance on
Mhm.
a daily basis. Because again, our posture, like I said, is a product of the world we created. And in all honesty, for most of us, we don't have to move all that much. Technology is so amazing these days, or it doesn't require us to move all that much. And so the movement that most of us do, even myself, everyone on this call, are usually very repetitive. Most of our jobs are probably very sedentary, sitting in front of a computer, and that's going to definitely cause imbalances in our body, which is, again, why we got to give ourselves the right exercise, the right movement, and keep it balanced. All right. So that shoulder and hip position, those kind of two the main things that we do see. So Carol, then what we do here at Egoscue is, we're using our postural analysis software here. We call it EP. All right, named after the founder, Pete Egoscue. So here we still have your pictures up there, but now we have these stick figures laid over your pictures here. So this is where we can now really start to manipulate in our system the right posture deviations we are seeing. So the two main things we saw were here on that front view. All right, so we can adjust these shoulders, and I can bring this right shoulder down a little bit lower to point out that difference in your shoulder position. And we go down here to the hips, we can adjust this, bring that left side up a little bit higher to, to record the hip position. Now this is just a couple. You can see there's side views. We can adjust those in terms of the shoulder position, where those low joints line up. We have the top view here on the far right, where we can really start to put in any twisting, any rotation that we do see in the upper body and the hip. So, when we do go through that full evaluation, we'll put all the postural deviations we see here. But the reason we do this, Carol, and everyone else on this call, is it really helps us from a therapy standpoint really pinpoint, okay, what are the major deviations that we need to address with the exercises? All right, so we'll put that into our stick figures here, and then what our system does is it then ranks and reads those posture deviations. And you can see here that it put the shoulder position, that hip position, very high in our ranking in terms of, okay, bubbling up the right exercises for Carol's posture, not for your symptoms per se, Carol, but is based on your posture. So the main deviations that we want our program to really recommend the right exercises, we got to make sure that we put that posture in there. And then it really helps it decide, okay, well, what are the best exercises given that posture? What are the best exercises to really help your body get fully realigned? And we can then go through these exercises and work with you as a client and try to figure out, okay, well, number one, are we able to do some of these exercises? Are we able to get into certain positions? Does lying down on your back hurt? Does sitting in a chair hurt? So we'll work with the client to really figure out, okay, what are the best exercises, not just for the posture, but what their body's able to do from a function standpoint, from a symptom standpoint as well. Okay. So once we've gone through that posture with you, Carol, once we've gone through the stick figures, we'll then put together that set of exercises for you. And then we build that program really based on how much time you're willing to invest, how much time you can invest on a regular basis. Because again, you got a job, you got a life and activities, things you want to do. So we really want to make sure that we tailor the program, not just specifically for your posture, but also, at a length where, hey, I can get this done on a consistent basis. All right. Because that's the best set of exercises that we can do, something that we can get done on a consistent basis. All right. You can see I got one of my therapists on here. She's already got some exercise ready to go. She's like, what about this? What about that? And again, that, most of our clients, obviously I'm talking with Carol, but anyone on this call, when we put together your program, I would say it's probably anywhere from 4 to 6 exercises on average that we'll give to our clients that they do on a regular basis, at least once a day. And a lot of times clients ask, well, can I do it more than once a day? I'm like, absolutely, you can do it more than once a day. The exercises are really to help keep your body in balance. So, like I said earlier in this talk, pain is a signal. So when that hand starts to hurt, when that back starts to hurt, one of the best things we can do as individuals is go, okay, I got this pain. Maybe I've been sitting too long. Maybe my body's getting a little off balance. Let me get up and do some exercise to rebalance my body, and then I can get back to work and not hurt. That's listening to the body. That's understanding that pain is a signal. So Carol, or anyone else on the call, any questions about that so far? Okay, well, listen, what I want to do now is want everyone to experience a little Egoscue right now. So let's go ahead, and I'd like everyone on the call to go ahead and slip your shoes off and stand up. We're going to go through a few exercises here. Let me turn my screen here. There we go. There I am. Okay. I'll turn my screen here so you're able to see me. So we're going to go through a little, we'll call this a little self-assessment exercise. So this is a good thing to do just to kind of get a feel of, okay, where your posture is, where some of the imbalances might be in your posture. All right. So shoes off, and you're going to go ahead and stand comfortably, and first thing, just close your eyes, just like what I did with Carol. Close your eyes, just march in place, wiggle out those shoulders a little bit, jump around if you need to, and just kind of let your feet go where they want to go. All right, don't try to straighten them out. Don't try to correct them. Just let your feet land where they want to land. Keep your eyes closed, and I want you to really get a feel for the weight distribution in your feet. All right, where is it from right to left? All right, do you feel like you're balanced from right to left? Or do you feel like you got more weight on the right foot, more weight on the left foot? Where's the weight front to back? Do you feel like you're more on the heels, more on balls of your feet? All right. Maybe it's hard for you to tell. Maybe like I feel like I'm wobbling all over the place. It's just I just don't feel like I got good balance at all. It's hard to really tell where my weight is. All right. So if you have a difference, or if you're not even sure, if you feel real wobbly, just make a mental note of that, because we're going to go back and test this again. Because if you do feel an imbalance, if you do feel unsteady, what that should be telling you is that our body is a little off balance. Those load-bearing joints, your shoulders, hips, knees, and ankles, are violating that blueprint of the human body, that design of the human body. All right. So now let's go through a few exercises. So first thing we want to do.
Hey Tim, you're really small right now because of the screen share.
Oh, thank you. My Zoom expert helped me out there. Okay. All right, so make sure you go to speaker view. Is that better? Okay, good. All right. So first thing you want to do is you want to get your feet pointed straight ahead, and you want them fairly narrow. When I say narrow, you want to be about the width of your fist from big toe to big toe. And you want those toes turned in so you're a little pigeon-toed, all right? All right. All right, so you got your toes turned in, little pigeon toe, and then what you're going to do is you're going to put your hands in this position here. We call this the golfer's grip. All right, it's like a half a fist. All right, that's the golfer's grip. So feet, nice straight position, hands in the golfer's grip, and then what you want to do is you want to pinch your shoulder blades together behind you and bring your arms out to shoulder level. All right, now shoulder level hurts, just lower your arms a little bit. Find a comfortable, even position from right to left. Get your arms in. All right. Show you from the side view here. So here, golfer's grip, shoulder blades together, arms out. What you want to try to avoid is doing something like this, where you let those hips bail forward. All right, so think about keeping shoulders, hips, knees, and ankles, everything stacked. So your arms out, you got your shoulder blades pinched, and then you're going to do circles coming towards the camera here, towards the computer screen. You want those circles to be small and fast. All right, keep those shoulder blades pinched. All right. Make sure those elbows don't bend. Keep those arms straight. About 10 more here. And then relax them down. Shake it out a little bit. Check your feet. Make sure they haven't started to move out on you there. And then we're going to do another set of these arm circles, but a little differently this time. Arms out again. You got your shoulder blades pinched together behind you. Now turn your palms up, and your circles go the opposite direction. Again, keep those shoulder blades pinched. Don't let the elbows bend. Really try to straighten those arms out. If there's any pain, try lowering your arms a little bit. All right? If it still is a lot of pain, just discontinue this exercise. This isn't something where you got to try to work your way through this pain. If there is pain, then that's your body saying, hey, not yet. Let's go ahead and stop that. Maybe try something else. All right. Shake it out a little bit. Check your feet. Make sure those feet are still pointing straight ahead. Next exercise we're going to do called the elbow curls. You're going to put your hands back in that same golfer's grip. And you're going to put your elbows right up here on your temples. All right, get a little bit closer for this one. So it's going to look just like that. All right. So you're staying in that standing position. What you're going to do is I want you to bring your elbows in front of you. Try to touch them if you can, or get them as close as you can. And then open them up as much as you can. You're just going to repeat that. In and out like that. We're going to do about 20 of those. In and out like that. Nice, smooth motion. All right. One of the things also you want to make sure of is, again, you don't want to let those hips bail forward as you're doing this one. Think about, again, keeping your shoulders, hips, knees, and ankles, everything stacked. Keep your hands in that golfer's grip. All right. Try not to let the elbows bend. Keep those elbows nice and straight. Keep your wrists nice and straight, excuse me. And out like that. Again, if you can't touch, you'll notice the more you do these, they'll start to loosen up on you. All right? Try to go as far in and as far back as you can. All right? That felt like 20. All right? Hard to talk and count. Shake it out again. Check your feet. Make sure your feet are staying in that same position. We're going to do one more exercise. All right? I want you to interlace your hands like this. All right? And you're going to push your palms away from you, like so. Elbows straight. Now, what you're going to do is you want to try to bring your arms as high above your head as you can, reaching for that ceiling. All right? But you want to make sure those arms stay straight. Try not to let the elbows bend. Just go as far as you can without letting those elbows bend. And again, don't let those hips bail forward. All right? Keep everything from your shoulder, hip, knee, and ankle stacked. Then you're going to look up towards your hands there. All right? Once you're in this position, last thing you want to try to do, without bending the elbows, is now try to let your shoulders relax down away from the ears. Remember to breathe. Nice deep breath in through the nose, out through the mouth. Keep your stomach muscles relaxed as you're doing this. We're going to be here a minute total, so probably about another 20, 30 seconds. Good. If you can, you want to keep reaching back and up. Arms are straight. Ten more seconds. And relax it down. Good, good. Again, shake it out a little bit. All right. Now, let's go back through that weight distribution test. So first thing you want to do, close your eyes, march in place, let your feet go back to a more natural standing position. Keep your eyes closed. And again, get a feel for the weight distribution in your feet now. All right. How has it changed? You know, do you notice how maybe you feel a little more solid? You don't feel like you're as wobbly as before. Maybe if you felt a little imbalanced right to left, it's a little more center. Maybe it's a little more center front to back. You know, if you were more on your heels on your toes. All right. You know, so even just those 3 exercises, you're going to notice some improvements. Maybe just even your shoulder. Like, I just feel better in my shoulder. Maybe just overall, maybe you have some back pain. Like, hey, my back pain doesn't hurt as much. Those 3 exercises did enough to really help your body get, move towards a more balanced position. All right. What's also unique is that, again, if we felt more balanced, more solid on our weight distribution, it really drives home that point of treating the body as a unit. Because we just did 3 exercises that really target at the shoulders and upper body, and we feel better in terms of our weight distribution. It really shows how the body works as a unit and why it's so important that we treat the body as a unit. All right. Nice job. Nice job. So yeah, those exercises, again, it really shows how quickly you can impact your posture, how quickly you get your body back into balance. And when it's in balance, again, that's when you're going to start to give the body the opportunity to heal, give the body the opportunity to move and with more freedom and really live a more pain-free life. Because now when your body is in balance, it has the opportunity to heal. It's not under a constant amount of stress. Because if our body is out of alignment, you got one shoulder higher, forward head position, or your offset, you name the postural deviation. Now our body's really having to fight more and more against gravity. All right. Remember back to that one gentleman we looked at where he was so offset to one side. You got to think how much his body, every time he gets up, how much his body's fighting just to stay upright against gravity. All right. And that puts a lot of strain on the body, because when our body's in balance, now gravity is that friend that we need. Gravity, we know we need gravity, but when our body's not in balance, gravity, we're fighting against that. And it's really putting a lot of strain on our body when it's out of balance. All right. Want to show you one more exercise. Why I got myself up, I got you up. This is a really good exercise, a very easy exercise, probably the most popular one for a lot of our clients. We call it the static back. So you're going to need something like this. I got this nice bench here. You can get a chair. Chair works really nicely, something like this, that I was sitting on. That could work really well for this as well. But the static back, the way you do this one, all you need to do is you got to lie down. You want to get as close to whatever you're using, bench or chair, as you can, so that when you get nice and close, you'll notice that my knees at 90 degrees and now my hips are at 90 degrees. And then you lie down flat on your back, arms out with the palms up. Then you just focus on letting your body relax and settle into the floor here. All right. Stay focused on your breathing. Nice deep breath in through the nose, out through the mouth. All right. Allowing the rib cage and the belly to expand as we inhale. All right. So as if some of you are trying to exercise, what you want to feel for once you get into that position is the lower back. Where is that lower back when you get down to that position? For some of you might notice that, hey, it feels like there's an arch in my lower back. It's not flat on the floor. That's something you want to wait and let it relax into the floor on its own. A lot of times clients get in that position, they feel like, okay, I gotta actively try to flatten that lower back. That's something that we want to allow the body to react to as they're in that position. So if you feel that arch in the lower back, or if you just feel an imbalance, like maybe you feel like one shoulder is heavier into the floor than the other, or one hip is heavier into the floor, you want to stay in that position for however long it takes for the body to feel more balanced. And usually that take anywhere from 5 minutes, sometimes longer, especially if you haven't done that exercise for a while. It could take as much as 15, 20 minutes. But the more you do that exercise, the quicker you'll notice the body start to balance out. The lower back will settle to the floor. That's a tremendous exercise to mitigate a lot of symptoms, whether it's upper back pain or lower back pain, knee pain, hip pain. It's a great position to really using gravity to help balance our body out. So it's a great place to mitigate that symptom there. All right. So those are 4 really good exercises. I'm going to go ahead. I'll email you those exercises, so at least you have those to get you started on getting your posture and your body back in the balance. So tomorrow I will email those exercises. You'll have pictures and instructions and videos to follow with on those exercises. Were there any questions on those exercises?
The last one, what do you do with your arms when you have your feet up on the chair, your legs up on the chair?
Great question. So the best thing to do is just have your arms out, probably more like a 45-degree angle from the body, all right, with the palms up.
Okay.
If that feels comfortable. For some clients, just having the arms out, maybe they might have some shoulder, maybe it's some nerve referral coming from the neck. They may not be able to get their arms in that position. So really, wherever's most comfortable for you, usually arms out, palms up is fine. But you can even lay them across your stomach if you want to. Anywhere is comfortable as far as where the arms need to be. All right, so we're kind of coming to the end here. We'll talk about what's next. So, like I said, some of you on this call are maybe familiar. Some of you are new to Egoscue. For everyone on this call, what I would say the next step for you would be is get your posture assessed. All right, let us go through that full. Like I said with Carol, we just did like a little piece of her posture. But what we would recommend for everyone is, let's get your posture assessed. Let us take you through those postural photos. Let us show you the imbalances we're seeing in your posture. Explain how that relates back to whatever symptom you are having, so you get a good idea in terms of the areas that really need to be addressed through the Egoscue therapy. So I highly recommend taking us up on that complementary posture assessment. If you want to take us up on that, please email me. There's my email address right there on the screen, tim@egoscue.com. Just give me an email, and I'll contact you, and we'll figure out a good day and time that we can hop back onto Zoom and go through that posture assessment, take those photos, show you how we would put them into our EP software, really explain what the next steps would be. Go over the different options we have, what we recommend in terms of the therapy options that are available to you. So that would be my best advice for you as far as what to do next. If this is making sense, if you want to again see if this is right for you, or again, like if you're already familiar with the Egoscue, you're like, okay, I just want to get a shot in the arm and really see where my posture is and get back on to do my exercises. Let's do that posture assessment. That'd be a really great place to start to figure out where to go from there and what is the best course of action for you moving forward. All right, you all, there you have it. That's your deep dive in what we do at Egoscue. So I'm open the floor now to any or the mic now for any questions you may have for myself or any one of the therapists that are on the call as well.
Hi, Maya here. I've been getting a lot of headaches lately, and I'm not sure, it could be a number of things, but is there a recommendation for sleeping? I feel sometimes like my head might be a little bit too forward when I sleep. I like to sleep on my side and my back. Is there anything you can recommend to maybe alleviate? I feel like my shoulders kind of rounded out through here.
Absolutely, absolutely. In my experience, headaches, again, there could be other factors that are causing the headaches, but a major factor that we run into a lot is the head position. That could be a forward head, that could be a head that's offset, that is contributing to that. So in terms of sleeping, one of the things I always recommend is the less pillow, the better. That would be one of the best things you can do. Other than that, when it does come to sleeping, what I usually recommend to the client is, listen, whatever gives you the most restful night's sleep, from a position standpoint, that's probably where you're going to end up anyway. What I would recommend to help you with your sleep, to help you stay asleep, help you maybe not get woken up with these headaches, is I would do that static back exercise that we just went over. We lay down, put your legs on the block or a chair. I would do that for a minimum of 10 minutes, even 15 minutes before you go to bed. All right. So do that right before you go to bed. Make sure you set a timer. All right. Because I've had plenty of clients fall asleep down there and wake up 4 hours later and their legs are asleep. So make sure you set a timer so you know when to crawl into bed. But I think that would be tremendous. And then another good one, I don't know, Maya, if you've, I think it's Maya, right?
Yes.
In some of your previous menus, if you had the wall drop exercise, where you stand on a slant board, that's a lot of times that's a good kind of one-off type of an exercise to do to really help correct your head position as well. Because like I said, that could definitely be a big reason why you're having the headaches. Others, probably things you're already working on. Are you hydrated? Is another big one as well. So that's something to look into as well.
All right, thanks. I might be a teeth grinder too. That's what my dentist told me. So I might have to get a teeth guard and see if that helps too. But I appreciate your input. Thank you so much.
My pleasure. Great question. Okay. Let's see, make sure I didn't miss any from the chat row there. Okay, well, good. That's going to wrap it up for tonight. I really appreciate you guys taking the time to join me tonight. And again, highly recommend take us up on that complimentary posture assessment. It really give you a clear idea of the relationship your posture is playing to whatever your situation is. And we can really go into a little more detail on what we would recommend in terms of, getting your body fully realigned, back in balance, and feeling good again. So definitely email me. You can email me tonight, tomorrow. I'll get a hold of you, and we'll set up a time for.